discuss a very interesting multi-center study on the use of closure devices, and we have with us the main author, which is Anna Maria Ierardi. So, Dr. Ierardi, may I ask you, which are the main benefits of using a closure device for the arterial access in general, in your experience?
Thank you, Professor Krokidis. For several years, the only method to achieve hemostasis was manual compression. Like everybody knows, manual compression is associated with the high incidence of complications, so hematoma, so pseudoaneurysm. And the introduction of closure devices reduced the incidence of complication from 11% to 3.5%. And only a small part of them need management with surgery. So in this way, we have also a decrease of length of hospitalization and of 30-day and 1-year mortality associated with complications related to vascular access. Moreover, we have to consider also the satisfaction of the patients, because the satisfaction is associated with a shorter bed rest, also in obese patients and in patients taking anticoagulants or antiplatelet agents.
In your study, in this specific multi-center study, how many patients were included and which were the main outcomes?
We collected more than 2,300 patients, and among them we selected 1,762 patients from 10 centers. And these patients in these patients we used the 5 and 7 French closure devices, and our main outcomes were effectiveness and safety. For effectiveness, it means the successful hemostasis without any complication and without the need of manual compression for non-balloon assisted closure device, and the 9 seconds of compression for occlusion assisted devices. And the secondary endpoints were also the association between some factors related to the patients, so the age, sex, and conditions like diabetes or hypertension, COVID infection, and the outcomes of the use of closure devices.
How can you explain the different outcomes between the various types of closure device that we included in your study?
We don't know exactly, but we have some proposed explanations. Because, for example, we found that the mechanism of action of a closure device is associated with outcomes. In particular, the use of occlusion balloon, of non-occlusion, balloon closure devices associated with better outcomes. And using occlusion balloon assisted device, you have to inflate the balloon within the artery, and it works like an anchor to ensure a proper placement of the hydrogel. And meanwhile you are inflating the balloon, there is a small amount of blood flows out the artery, and it should be an explanation. And the other finding was the incidence of arteriovenous fistula that resulted higher in patients in which we used non-balloon occlusion devices. We hypothesized that in our series we don't use the ultrasound guidance to obtain the access. So more than one hole in some patients was done, and the fistula may be created for a hole, for one of the hole in which sheet was not introduced. So the inflation of balloon and the manual compression may help to have an easier occlusion of the fistula, for example. But of course, we don't have evidence about that. It is also our hypothesis.
Well, thank you very much for sharing your valuable experience of this multi-center study. I'm sure that the readers of CVIR will appreciate very much your contribution. Thank you so much.